move to periodontics and preventive dentistry. Primary tooth with caries exposure and healthy radicular pulp, pulpotomy. Vital immature permanent tooth with open apex, apexogenesis. Pit and fissure sealant is contraindicated in gross proximal caries or cavitated lesions. Most common space maintainer for unilateral loss of the first primary molar, band and loop. Index for caries in the primary dentition, DMFT. First permanent molar erupts around 6 to 7 years. Nursing bottle caries is strongly associated with prolonged nighttime bottle feeding or sugary liquids. Optimal fluoride concentration in community water for classic exams are about 1 ppm. Flush terminal plane most commonly transitions to class 1 by early mesial shift, leeway space mechanisms depending on what stage. Bilateral loss of the mandibular primary molars after eruption of incisors often uses lingual arch. Most common cause of early childhood caries, frequent fermentable carbohydrate exposure with poor feeding or oral hygiene habits. Apexogenesis aims to preserve vitality for continued root development and apical closure. Next, let's move to orthodontics and dentofacial orthopedics. Most common angles malocclusion, class 1. Class 2 div 1 is characterized by proclined maxillary incisors with increased overjet. Class 2 div 2 is characterized by retroclined upper central incisors with deep bite. Div 1 and div 2 apply only to class 2. Growing class 3 due to maxillary retrusion is best managed early with face mask with expansion. Thumb sucking commonly produces anterior open bite. SNA angle indicates anteroposterior position of maxilla. SNB angle indicates anteroposterior position of mandible. ANB angle indicates maxillomandibular sagittal relationship. Crossbite with mandibular shift on closure is usually functional crossbite. Class 2 div 2 management trap. Unlock the bite first by proclining the incisors and then opening the deep bite. No clue in malocclusion questions plus normal molar relation plus crowding rotation, class 1 malocclusion. Next, periodontology. Most common pattern of periodontal bone loss, horizontal bone loss. Deep probing due to gingival enlargement without clinical attachment loss, pseudo pocket. Defect best suited for regeneration, vertical or infrabony defect, especially the narrow deep multivalves. All are features of the gingival enlargement, no bone loss, apical migration of the junctional epithelium. Choose apical migration of the junctional epithelium. Most common causes of bleeding on probing, inflammation. Suprabony pocket base is coronal to the alveolar crest. Infrabony pocket base is apical to the alveolar crest. Horizontal bone loss usually accompanies suprabony pockets. Vertical bone loss usually accompanies infrabony pockets. Grade 3 furcation means through and through bone loss but not necessarily clinically visible if covered by the gingiva. Trauma from occlusion radiographic clue, widened PDL space. Primary etiological factor in periodontal disease, dental plaque biofilm. Next, moving to prosthodontics, crown and bridge. Most important factor for retention of maxillary complete dentures, peripheral seal with posterior palatal seal. Primary stress bearing area of the mandibular complete dentures, buccal shelf. All are rigid impression materials except ZOE, plaster, compound alginate, choose alginate. Jaw relation required before arranging the complete denture teeth, centric relation. Posterior palatal seal helps to compensate for polymerization shrinkage and improving the retention. Phaseboard transfer records relation of the maxilla to the hinge axis or the articulator. Kennedy class 4 has no modification space. Most commonly used mandibular major connector if sulcus depth is adequate, lingual bar. Support in RPD means resistance to movement towards tissue. Yes, that's true. Retention means resistance to dislodgement away from the tissues. Yes, that's true. Stability means resistance to horizontal or horizontal movement. Yes, that's true. Classical sequence in edentulous impressions. Compound begins, green stick border molds, final wash with ZOE or elastomer depending on the technique. Next, let's move to conservative dentistry and endodontics. Most common irrigant in endodontics, sodium hypochlorite. Most common intracanal medicament, calcium hydroxide. All are advantages of rubber dam except moisture control, patient protection, visibility, increased aspiration risk. Choose increases the aspiration risk. Most likely pulp test response in irreversible pulpitis, exaggerated lingering pain. Most common cause of post-endodontic flare-up, microbial debris extrusion beyond the apex. EDTA used primarily for remove the smear layer, chelate the calcium. EDTA does not do dissolves the organic pulp tissue. Gate Glidden drill is used to enlarge the canal orifice or the coronal portion. Apical constriction is usually located near cemento-dentinal junction. Most exam-safe direct pulp capping material method is calcium hydroxide or MTA. Most common cause of post-operative sensitivity in composite restorations, polymerization shrinkage or the marginal gap depending on what the question is. GV Bax lesion generally occurs in pit and fissures. Oral and maxillofacial surgery. Most common site of mandibular fracture overall, condyle. Immediate management of syncope in dental chairs, supine position with the chair elevation. Immediate best step for Eval's permanent tooth when feasible, replantation. All are signs of the dry socket except severe pain, foul odor, loss of clot, pus discharge always present. Choose pus discharge always present. Most common cause of Ludwig's angina, odontogenic infection from the lower molars. Most commonly impacted tooth, mandibular third molar. Nerve most at risk in the mandibular third molar surgery causing the tongue paresthesia, lingual nerve. Lefort 1 fracture is also called floating palate. GCS severe injury threshold 8 or less. Drug of choice in anaphylaxis in dental clinics, IM adrenaline. Classical dry socket timing, pain beginning 1 to 3 days after extraction. Open mandibular fracture in dentistry typically needs antibiotic coverage and definitive stabilization. Let's move to the public health dentistry. Most common index for caries experience in permanent dentition, DMFT. Most likely index for oral hygiene status, OHIS. Most likely index for periodontal screening, CPI. All are measures of central tendency except mean, median, mode, standard deviation. Choose standard deviation. Study design best for prevalence, cross-sectional study. Incidence measures new cases over time. Sensitivity means true positive rate. Specificity means true negative rate. Mean is most affected by extreme values. Case control studies are best for rare diseases or studying the association backwards from the outcomes. Mixed subject blitz, which is most common, most likely, or the exception traps. Finishing with the last 10 questions. Antibiotic-mediated hypersensitivity reaction includes 1, 2, 3 exception, type 4. Immediate allergy plus IgE plus mast cells, type 1 hypersensitivity. Contact dermatitis plus delayed plus T cells, type 4 hypersensitivity. All are reversible impression materials except agar, wax, compound alginate, choose alginate. Pocket base below the alveolar crest, infrabony pocket. Retrocline maxillary centrals and deep bite, class 2 div 2. Vital pulp plus open apex plus continued root growth is desired, apexogenesis. Deep probing with gingival enlargement but no clinical attachment loss, pseudo pocket. Caries experience in permanent dentition, DMFT. Coronal pulp remove, radicular pulp kept vital, pulpotomy. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.